The response to immune checkpoint inhibition is linked to the fact that the T cells, which are reinvigorated by this approach, recognize what we call neoantigens on the tumor cells and kill the tumor cells. So the ways to non-response, that some patients respond and others do not, is one, there are patients who have a high number of neoantigens because they have a high mutational burden, for instance, smokers in lung cancer, whether patients with a low mutational burden and low numbers of neoantigens. Another way is that the T cells can be activated, but they are unable to go into the tumor because there are mutations in the tumor cells that keep them out of them. And thirdly, to make it very simple, the other cells of what we call the tumor microenvironment may inhibit, extinguish the immune reaction just in certain patients. For instance, macrophages, neutrophils may do that job, preventing the T cells to exert an anti-tumor effect. These mechanisms coming from the tumor microenvironment are very essential to be known, to be capable of developing novel approaches to take them under control. In one word, if you have a tumor that has lost HLA antigens and does not present neoantigens to T cells, there's very little that you can do about it. On the other hand, if you have a modification of the tumor microenvironment, many immunosuppressive cells there, if you have identified them, you could potentially target them with therapeutic approaches, antibodies or drugs, and therefore disbalance the immune microenvironment in favor of immunity and against immunosuppression.